What if the reason your blood pressure medication isn't working as well as it should has nothing to do with the medication itself, and everything to do with a nutritional deficiency your doctor hasn't had time to investigate? Today, I'm walking you through 7 vitamins and nutrients that research shows can lower blood pressure even when medication alone isn't enough. Not just what they are, why they work at the biological level, inside your body. I'm Dr. Mandy Thomas. Stay through all 7, because the last one is something over 80% of seniors are deficient in, and it may be the single most overlooked reason blood pressure stays stubbornly high despite everything else being done right. Number 7, B vitamins, folate, B6, and B12. Almost no one associates these with blood pressure. That's a serious gap, and here's why it matters. Your body naturally produces an amino acid called homocysteine when it breaks down protein. In healthy amounts, it's completely normal. But here's the surprising part. Your body can only process and eliminate homocysteine when it has adequate folate, B6 and B12. When those levels are low, and they frequently are in seniors over 60, homocysteine accumulates in the bloodstream. Think of your blood vessels like the inside of a brand new garden hose. Smooth, flexible, and free-flowing. Elevated homocysteine slowly scratches and stiffens that inner lining, forcing blood to push harder through increasingly rigid channels. The medical term for that inner lining is the endothelium, and when it's damaged, blood pressure climbs. I've had senior patients exercising regularly, watching sodium, taking medications faithfully, still without consistent control, because nobody had ever checked their B vitamin status. Once we corrected the deficiency, the picture changed. Foods rich in folate, spinach, black-eyed peas, fortified cereals, B12, lean meats, and eggs. But here's a catch that's important for seniors specifically. B12 absorption decreases significantly with age because the stomach produces less acid. Eating B12-rich food is often not enough. A methylcobalamin supplement, the most bioavailable form, is particularly important for anyone over 60. Number 6, vitamin C. You've heard about vitamin C hundreds of times. Not like this. Every day, your body produces free radicals as a normal byproduct of metabolism. When you're well-nourished, antioxidants neutralize them before they can cause damage. As we age, free radicals begin to overwhelm the body's defenses. And here's the surprising part. They attack the inner lining of your arteries, the same endothelium we just talked about. When the endothelium is under this kind of oxidative attack, it produces less nitric oxide. Think of nitric oxide as your body's built-in blood pressure regulator. It signals the smooth muscle in your artery walls to relax and widen. When production drops, arteries tighten. Blood pressure climbs. Vitamin C's role here has nothing to do with colds. It's about preserving the structural integrity of your blood vessels. Best food sources: bell peppers, citrus, strawberries, broccoli, kiwi. For seniors with low dietary intake, 500 milligrams daily as a supplement is safe and research-supported. Drop a comment right now. Are you currently taking any supplements for blood pressure or heart health? I read everyone. Number 5, and this one isn't technically a vitamin, but the evidence supporting it is stronger than almost anything else we've covered so far. Omega-3 fatty acids. Found primarily in fatty fish, salmon, mackerel, sardines, trout, omega-3s reduce inflammatory compounds that cause vessel constriction, improve the elasticity of artery walls, and help reduce triglycerides, which in elevated amounts contribute to arterial stiffness. A comprehensive analysis by the American Heart Association found that roughly 3 grams of omega-3s daily reduced systolic blood pressure by an average of 4.5 points in people with hypertension. For a senior already on medication, that can be the difference between needing an additional drug and not needing one. But here's the catch most seniors miss. Dosage matters enormously. A standard fish oil capsule might contain only 300 milligrams of active EPA and DHA. You would need 10 of those to reach a therapeutic dose. Look for concentrated fish oil products delivering 2 to 3 grams of combined EPA and DHA per serving, and always tell your doctor. Omega-3s have mild blood-thinning effects that matter if you're on anticoagulants. Number 4, and this one involves something I consider a silent problem for a massive portion of the senior population. CoQ10. CoQ10 is found in every cell in your body. Its job is helping your mitochondria generate the fuel cells need to function. And the cells with the highest energy demand in your entire body are heart muscle cells, because your heart beats every second of every day without rest. When CoQ10 levels drop, the heart has to work harder to pump the same volume of blood. Blood pressure rises as a result. Here's the part that genuinely stuns most of my patients. Statins, among the most commonly prescribed medications for seniors, deplete CoQ10 from the body. The enzyme statins block to reduce cholesterol is the same enzyme involved in producing CoQ10. So while the medication protects against one cardiovascular risk, it simultaneously depletes a nutrient the heart critically needs. Multiple clinical trials show that CoQ10 at 100 to 200 milligrams per day produces meaningful reductions in both systolic and diastolic blood pressure. Form matters. Look for ubiquinol rather than ubiquinone, particularly over 65, as it is significantly more absorbable. If you're on a statin, please raise this at your next appointment. Now I want to pause here. If you're over 60 and want clear, science-based cardiovascular health information every week, hit subscribe right now. Every week I share one evidence-based tool that can genuinely move your numbers. And share this today with a senior you care about who has been on blood pressure medication for years without optimal results. The next 3 nutrients are where the biggest clinical gains tend to be. Number 3, vitamin D. Here's something most patients have never been told. Vitamin D functions more like a hormone than a traditional vitamin, and one of its most critical roles involves directly regulating blood pressure. Your kidneys produce an enzyme called renin. When renin is released, it triggers a cascade that causes blood vessels to constrict and the body to retain sodium, both driving pressure up. This is the exact mechanism that ACE inhibitors and ARBs are designed to block. What most people don't know, vitamin D naturally suppresses renin production. When levels are adequate, your kidneys produce less renin, less constriction occurs, less sodium is retained, and blood pressure tends to be lower. When vitamin D is deficient, renin goes unchecked. One of my patients, a 74-year-old woman who spent almost no time outdoors, had been on 2 blood pressure medications for 3 years with only partial control. Her 25-hydroxy vitamin D level came back at 17 nanograms per milliliter, severely deficient. 6 months after correcting it with supplementation and some gentle morning sun exposure, her systolic had dropped 14 points. We hadn't changed a single medication. The appropriate test is the 25-hydroxy vitamin D test. Optimal levels for seniors, between 40 and 60 nanograms per milliliter. Most physicians start with 2,000 IU of vitamin D3 daily and adjust from there. Number 2, potassium. The science behind potassium and blood pressure is not subtle. It is foundational cardiovascular medicine, and yet most seniors are dramatically underdoing it. Potassium works in direct opposition to sodium. Sodium causes cells and blood vessels to retain fluid and tighten. Potassium actively counteracts that. It helps the kidneys eliminate excess sodium, relaxes blood vessel walls, and maintains the fluid balance that keeps pressure in a healthy range. Here's what makes this especially urgent for seniors. Certain diuretics commonly prescribed for blood pressure actually cause potassium loss through urine. Many older adults are fighting their hypertension with one hand tied behind their back, restricting sodium diligently while a medication quietly drains the mineral that's supposed to help. A 68-year-old patient of mine had been carefully watching sodium for 2 years. We added a focused effort to rebuild potassium through food: sweet potatoes, avocados, white beans, spinach, bananas, and within 8 weeks, his systolic had dropped 11 points without changing his medication. We hadn't taken anything away. We'd simply given his body what it had been missing. Best food sources: bananas, sweet potatoes, avocados, white beans, spinach, oranges. The recommended daily intake is around 4,700 milligrams. Most seniors are getting far less. Important note, if your kidneys aren't functioning optimally, high potassium intake requires medical supervision. Always speak with your doctor first. And now we reach the nutrient I've been building toward this entire video. The one that, in over a decade of clinical practice, explains more cases of stubborn, resistant, medication-defying high blood pressure than anything else I've encountered. 3 completely separate biological mechanisms connect it directly to blood pressure, and the deficiency rate among seniors is nothing short of staggering. This is also the moment many patients realize their blood pressure problem may not be permanent. It may simply be missing information. Number 1. Magnesium. Magnesium deficiency is, without exaggeration, one of the most widespread and underdiagnosed nutritional problems in older adults. Studies consistently show that the majority of seniors fail to meet even the minimum daily requirement. And here's why that matters so profoundly for blood pressure. 3 mechanisms, each powerful on its own. Mechanism 1. Magnesium is a natural calcium channel blocker. Calcium channel blockers are an entire class of blood pressure medications because calcium flowing into smooth muscle cells in your artery walls causes those arteries to contract and pressure to rise. Magnesium, when present in adequate amounts, regulates that calcium entry. When magnesium is depleted, calcium floods in unchecked. Arteries constrict, and blood pressure climbs. Your body has a built-in version of this medication, and most seniors aren't giving it what it needs to work. Mechanism 2. And this is the part that shocked me early in my career, when I first saw what magnesium deficiency actually looked like on a lab panel. I had a patient in her late 60s on 4 blood pressure medications, whose readings were still averaging 158/96. Her magnesium came back critically low. We corrected it over 3 months. Her readings settled to 131/80 on the same medications. Nothing else changed, just that one number on a lab panel. Magnesium regulates the sodium-potassium pump in every cell. This pump moves sodium out of cells and potassium in. Without adequate magnesium, the pump loses efficiency. Sodium accumulates, potassium leaks out, fluid balance is disrupted, and blood pressure rises. Mechanism 3. Magnesium influences the release of a compound called prostacyclin that helps blood vessels widen. When magnesium drops, prostacyclin production decreases, vessels remain constricted, and pressure builds. 3 mechanisms, all pointing to the same outcome. Why are so many seniors depleted? Magnesium absorption decreases with age. Several common medications, certain diuretics, proton pump inhibitors for acid reflux, metformin for diabetes, actively deplete it. And a modern diet high in processed foods is chronically low in magnesium-rich whole foods. I've had senior patients whose blood pressure simply refused to respond to multiple medications. And when we finally corrected a profound magnesium deficiency, the transformation was striking. Readings stuck in the 150s and 160s for years dropped into the 120s and 130s on the same medications. The missing piece wasn't a stronger prescription. It was a mineral costing pennies per day. Form matters. Magnesium glycinate is among the most bioavailable and is gentle on digestion. Magnesium oxide, extremely common in budget supplements, is poorly absorbed and frequently causes digestive discomfort. Start at 200 milligrams daily and work up to 400 milligrams with your doctor's guidance. Magnesium-rich foods, dark leafy greens, pumpkin seeds, black beans, almonds, whole grains. Your action plan. 1. Get tested before buying a single supplement. Ask your doctor about a comprehensive nutritional panel covering vitamin D, magnesium, B12, and homocysteine. 2. Address vitamin D with a specific target. Use the 25-hydroxy test to establish your baseline. Work with your doctor to bring your level to between 40 and 60 nanograms per milliliter using vitamin D3. 3. Prioritize magnesium. If you're over 70, statistically, you're almost certainly not getting enough. Start with magnesium glycinate and add magnesium-rich foods daily. 4. Rebuild potassium through food first. Sweet potatoes, avocados, spinach, beans, bananas. Let your doctor guide you if you have kidney concerns. 5. If you're on a statin, talk with your doctor about ubiquinol CoQ10 at 100 to 200 milligrams daily. 6. 2 to 3 servings of fatty fish per week plus a concentrated fish oil supplement, delivering 2 to 3 grams of combined EPA and DHA. 7. For B vitamins, focus on leafy greens, legumes, eggs, and lean meats. For B12 over 65, a methylcobalamin supplement is often necessary regardless of diet quality. 8. Add vitamin C through food whenever possible. If dietary intake is low, 500 milligrams daily is safe and beneficial for most seniors. 9. Give these changes time. Arteries don't stiffen overnight, and they don't recover overnight. These biological processes take weeks and sometimes months of consistent effort. 10. Track everything. Log blood pressure readings at the same time each day, record when you started each supplement, and bring this data to your next appointment. Real numbers create real conversations. I've put together a free senior blood pressure nutrition guide, a one-page printable covering all 7 nutrients, recommended forms and doses, best food sources, and the questions to bring to your doctor. I created this for my clinic patients and decided to release it publicly this week. Download it from the description before we move it back into the patient portal. Subscribe if you haven't. Share this with a senior you care about whose blood pressure has been resistant to medication. They may be one piece of missing information away from a real breakthrough. Next video. The 5 biggest blood pressure mistakes seniors make, including one that affects how accurate every reading you take at home actually is. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before starting any new supplement, especially if you are on blood thinners, diabetes medications, or kidney medications. Never stop or adjust blood pressure medication without consulting your healthcare provider first.